That was weird. Hold on. There we go. How are you doing this afternoon, Michael?
Doing great. How are you?
I am good.
Awesome.
So today we're going to hopefully have Kim on to discuss we have a petition that she's created to try to stop it. And so it's important enough that we really need to focus on it and get the word out about it, because I haven't really seen anybody standing up against it at all. Not Democrats, not Republican, nobody.
No,
So
not really.
I actually don't even hear it ever mentioned.
Yeah, and it's something that's very important that we need to pay attention to, because they declare vaccine promotion a top state priority. And you know what happened last time with the mandates, and that they might get back to doing that again, even though they got sued.
Right. And they're wanting to remove the religious exemptions as well.
Oh, yeah.
And we already had an issue with that during COVID, so, and they've already removed it from the MMR, trying to force everybody to take that one.
It's interesting because it requires officials, quote unquote officials, to implement evidence-based measures. And the thing that, really confuses me is that there is no placebo testing on any of these vaccines. This is not evidence-based or not science-based medicine, right? But they're saying that they need to implement evidence-based measures. So maybe they just need,
right,
big pharma approval to push it through. And then it voids any local law.
They're not interested in.
Yeah.
It
voids any local law or policy that contradicts the state directives. So if a county or a city wants to go against whatever the Health Alliance says, it's basically saying that the Health Alliance, the law, ESHB 1531, supersedes anything at the local level, which is a gross violation of our rights.
Absolutely. Yeah, it's an incredible overstep. And it's not just Washington, it's Oregon, California, Hawaii. And then we're hearing whispers of Nevada signing on to it as well. And that actually, from what I understand, means that if there's a crisis, if they determine a crisis, right, whatever they decide that means in Oregon, that they can actually do that throughout all 5 states. So if they start implementing mandates in Oregon because they have an outbreak of, I don't know, measles, monkeypox, who freaking knows, right? They're going to mandate that everybody has to get a vaccine for it. And then they're going to stop us from being able to do things like they did during COVID.
Yeah, they're going to go right back
to that. In another state. Other states are going to determine what happens in Washington. Mm-hmm. Ours is bad enough.
Yeah, I know.
So yeah. I did post the link to the Sorry, I was just hearing from Kim.
Yeah, so, to go in this a little further, the directive authorizes vaccination of all individuals aged 6 months and older. And as we know, the COVID vaccine had basically no positive effect for young children because they were pretty much statistically at almost a zero to being negatively affected by COVID. It also includes pregnant women and off-label vaccine use. It relies on provider discretion, not parental consent. So children can be vaccinated without parental consent at government education facilities, quote unquote public school. And there's no opt-out provisions. So there's no way to opt out, and there's no requirement for informed consent. And that is the standing order.
Sorry, I
issued
am
by the
trying to figure out how to
Washington
get
State
Kim
Department
on
of Health.
here.
There's an add button, and you can copy the link and send that directly.
Okay. I am not sure that I have this figured out enough to get Kim on here. She's having a hard time getting on.
All right, you want to send me her email and I can send her the link?
I don't know what is going on with my internet connection. It is very
Yeah, you're very choppy.
Are you
Yeah, so it looks like Tony's frozen. Can you hear me, Tony?
It completely kicked me out. I have a really bad internet connection today. It's crazy. I don't know why it's being so weird.
Yeah, I don't know, but it's not going live on our Facebook page, by the way.
Oh, it's not.
No, I don't know where it's going live at, but it's not on the Facebook page.
Okay, here, I'm going to shut it down and we'll try it again.
Okay.